What's an athlete to do when a coach or a trainer or even the team physician recommends therapies that are anti-healing? Well, absolutely, the athlete's got to take care of their body. So if you have an injury, you have to do therapies that stimulate healing. Therapies such as heat, motion, exercise, supplements, diet, therapies such as physical therapy, prolotherapy stimulate healing. So if an athlete, with every injury they have, they do therapies like that stimulate healing, there's a very good chance the athlete will go through their athletic career fine. They'll heal injuries. They won't have any long-term sequelae like arthritis or chronic pain because they healed all their injuries. Once an athlete stops healing, you have a tendon tear, tendinitis, ligament injury, and you start using anti-healing therapies. The anti-healing therapies are rice, rest, ice, compression, elevation, anti-inflammatory medications, ibuprofen, naproxen, Aleve, cortisone shots. Once you start doing those therapies, you're inhibiting the body's ability to heal. So if you inhibit the body's ability to heal, you're going to be left with a weakened ligament, weakened tendon, an unstable joint, and all that's going to happen is you're going to accelerate the arthritic process. So you're going to end up with chronic pain. So if you want to end up with chronic pain, then go ahead and do those therapies. Do what your coach recommends, do what your team physician recommends, do what your trainer recommends, but I would recommend absolutely don't do any anti-healing therapies. You're doing athletics, you're training really hard, so when you do get an injury, you have to take responsibility and do the therapies that are best for you. And we've had plenty of athletes come here, even professional athletes, where they came in here themselves. They came here themselves. Professional football players, for instance, have Tuesdays off. I know they have Tuesdays off because they would fly in here from all over the country because they have Tuesday off, and they would come here even during the season and get various treatments because they want to get treatments that are going to keep them playing. So you can still play while you get prolotherapy. It may be harder to cure you of your pain, but at least you can, while you're, actively in season, but, at least you can still play. So if you're a professional athlete, you have to be on the roster. Once you're off the roster and you're on the disabled list, and the quickest way to get on the disabled list is to do therapies that inhibit healing. So don't do therapies that inhibit healing. Every athlete should have their own personal advisor, whether it's a doctor, or it's a trainer, or it's a nutritionist, or someone who's looking at you that's not affiliated with the team, that will give you straight up advice, what to do, what not to do. You got to realize a coach is primarily concerned with this season, where me as a physician, I'm concerned with you, I'm concerned with this season. Trust me, I'm concerned with you as far as this season, but I'm concerned with next season, the next season. And I'm going to be 48 soon, so I'm just about 48. And I still run, I still bike, I still cycle. So you may be playing baseball now, but trust me, when you're 48, you still want to play baseball. You still may want to swim, you still may want to run. So is it worth it for you to get a cortisone shot so you can do something now, and then next season, you've weakened those ligaments and you've weakened your cartilage because you got a cortisone shot, and now, you can't play college sports, you can't play soccer with your buddies, because your knee's all wrecked. It's just not worth it. It's not worth it. Just do what's best for your body.